An epidemiologist and ABC News medical contributor, Dr. Todd Ellerin, joins me now for more on all of this. Dr. Ellerin, let's start with this FDA approval. Americans have been taking this vaccine for months now. So what does FDA approval really mean? How does that change things?
Right, Diane, it's a great point. We've already given billions of doses around the world, hundreds of millions in the United States under the emergency use. So I think the full application, what it means is for the FDA to give these vaccines full licensure, there has to be more months of safety data, more months of effectiveness data. They really have to see this. So it's really a time with people rolling up their sleeves. Look, we know that this vaccine has been scrutinized more than any other vaccines in the world, really. So we know that the FDA will ultimately give, what we call the BLA to these vaccines because they are so safe, they are so powerful, and let's face it, it's the major reason why we have such a decreased number of cases in the United States, decreased hospitalizations, decreased deaths, and why we're starting to be able to relax a lot of the restrictions that we've had to endure over the past year.
So for people who feel hesitant about getting vaccinated, should this pending approval give them a bit more confidence?
I certainly wanted to, Diane. When we look just in our system, in my hospital, the people that are coming in right now with COVID are the people who are unvaccinated. The people who are in our intensive care unit right now are the ones that are unvaccinated. Now, with that said, the numbers are much lower. We are doing so much better than when we were doing before. But I want the young women to know that this vaccine does not lead to infertility. The New England Journal of Medicine just published on that and showed that it's just as safe, these vaccines, in pregnancy as in non-pregnant people. So that type of messaging is just what I'm hoping for, because I don't want to see the headlines that the people who are hospitalized and in our intensive care units are the unvaccinated folks.
And you talked about how things are finally getting better. We're hearing now California could see herd immunity by June. So what do you make of that, given how bad things were there in California just 5 months ago?
I mean, you know the answer. It is the power of the vaccines. Sure, it's also somewhat of natural infection. So many of us have been infected naturally by this virus. But I think what we're really seeing is the power of these vaccines. It's incredible to watch, given that we were dealing with the greatest plague, in the century, and it's still so heartbreaking to see other countries, now many of the poorer countries, that are being hit so hard. And just to remember, while, yes, we've turned the corner, but COVID-19 is not over. As long as India, for example, is burning with COVID-19, that could potentially get back to us. So we really have to help other parts of the world that are struggling right now.
And Pfizer and Moderna seem to be getting closer to authorization for 12 to 15-year-olds. So what are they looking for in these studies to make sure that vaccines are safe for that group?
Right. Just as you just noted, what the FDA is going to look at is that lens of safety. They're going to make sure. Remember, this is preventative, and we know this is in a population that tends to do better. So that bar of safety is even higher, and the FDA will make sure of it. Obviously, from the data that we've seen in the trials of now Pfizer and Moderna, they look extremely safe, and we expect them to look safe. So I'm both thumbs up for the FDA giving EUA to both Pfizer and ultimately Moderna for the adolescent age group.
But the Kaiser Family Foundation reports just 3 in 10 parents say they plan to get their 12 to 15-year-olds vaccinated immediately. What's your message to those parents?
Well, I think most importantly, just know that I have a 12-year-old and I have a 15-year-old right now, and I am waiting with bated breath to get them vaccinated. They're excited as well. They know that this vaccine, in order to get the proper vetting through the FDA, means it has to be safe, and they're feeling very good about that. And also, they know that they are part of the cascade of transmission. It's not just about adults. And they also know and are scared of that rare but very serious multi-system inflammatory syndrome that we've heard about. And while it is rare, they don't want to be that rare person. And as a parent, I feel so incredibly encouraged that they're willing to roll up their sleeves and get vaccinated when their time has come.
And listen, we all watched you get vaccinated on air, as well as several other respected doctors in our community. And I'm sure when it comes time for the kids, knowing that your kids are going ahead and doing it will help to boost confidence as well. Dr. Ellerin, it's always great to have you. Thank you. Fingers crossed.
You too.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.